All right, hi everyone. Thank you so much for coming to this panel today. We'll be getting started with introductions. Gabrielle, would you like to start?
Sure. So hi everyone, my name is Gabrielle Huizinga and I am a second year immunology PhD student at the University of Michigan. So I joined both of my labs. I'm co-mentored right now, and I joined both of my labs right when the pandemic started. And so when I joined the labs, my project was going to be focusing on how obesity impacts the response to pulmonary bacterial infections. But since we've noted that during this pandemic, a lot of patients who have had severe disease are obese, my work moving forward is going to be looking at how obesity impacts the host response to viral infections. I've also received both of the Pfizer vaccine doses. So if you have any questions about the Pfizer vaccine, I'd be happy to answer those. Is there anything else I should add, Isabel?
No, that was a great, perfect introduction.
All right.
All right, Dr. Gaffney.
Hi, I am Dr. Alexea Gaffney. I publicly go by Dr. Alexea. I am a triple board certified infectious disease physician. I'm boarded and trained in internal medicine, general pediatrics, and adult infectious diseases. I went to med school at home, basically, at SUNY Downstate Medical Center in Brooklyn, New York, and then came out to Long Island to SUNY Stony Brook, which is where I did both my residency and fellowship training. And I currently work in a hospital-affiliated private practice. I do primarily infectious disease consultation as an outpatient provider, although during the first wave of the pandemic, I did return to inpatient consultation to help manage COVID patients. And I do some internal medicine and transition of care. So for adolescents who have chronic medical conditions like autoimmune disease, cystic fibrosis, sickle cell, who are transitioning from the pediatric care space into the adult space, I preferentially get referred those types of patients to my practice. So I kind of do a little bit of a lot of things, but it makes my job interesting, fun, and exciting. And I'm so happy to be here sharing with you all. I'm also vaccinated for COVID-19. I also received the Pfizer COVID-19 vaccine and happy to answer questions about that as well.
Great, thank you so much. And for our last panelist today, Dr. Furuzesh. I think you're muted.
1 minute. Hi, do you hear me? Okay, I had a little bit technical difficulty, so I'm joining you guys now. Yes, so I'm a double board certified infectious disease and internal medicine doctor in Hoboken, New Jersey. I did my internal medicine residency at North Shore Medical Center in Long Island, and I completed my infectious disease fellowship at Westchester Medical Center in New York. And currently I am in private practice, self-employed infectious disease doc, seeing patients both in outpatient and inpatient setting. And during this COVID pandemic for the past year, of course, we've seen everything. It's been busier than ever, but also most interesting time, I would say, of my career.
Well, I'm glad it's interesting.
Yes.
And again, hi everyone. My name is Isabel. I would like to thank everyone for coming, especially the panelists. I'm the CEO and co-founder of GenerationMed, and I'm so glad you guys are here. Once again, to go over the format of this event, we will start by me asking you guys some general questions, specifically about the COVID-19 vaccine, how you guys have felt after getting it, especially if you have gotten it so far. And then we'll open up the floor to participant Q&A, where participants will be encouraged to either turn their cameras on and speak to you guys directly, whether it be a little bit more about your own specialty, what you're doing, or just leave a general question in chat. So without further ado, let's get started. Maybe the first question is, when COVID-19 was first announced to be in the United States, how did you guys feel as either an immunologist or an infectious disease specialist?
Do we take turns or you? Okay.
Yeah, I'm sorry. You guys can just go ahead.
So at first, when it was announced back in December 2019, January 2020, I wasn't really sure what to think. I didn't know if it would spread to the United States and what that spread would look like. I was really hoping that it would be able to be contained before it spread throughout the world. And then it started spreading, and I started getting really nervous about what life was going to be like. And I remember this day very clearly. March 9, 2020 is my brother's 21st birthday. And we were all getting together with my family. And that was the last time that I hugged any of my 4 grandparents. And the next weekend, COVID-19 was declared a pandemic. And I just remember being at my house with my parents and my grandparents, and we were all saying, like, we don't know what's going to happen. At that point, it was getting really scary. And then that Wednesday, my boyfriend works as a lab tech in the Michigan Medicine Hospital, and he had texted me while he was on his lunch break saying that they had 2 COVID positive samples come up in the hospital. And that afternoon, we got word from campus that the next 2 days, campus was going to be shutting down. And by Monday, everything was going to be virtual. So that's when it really hit me how severe the pandemic was. A week after that, they shut down research labs. And as an immunologist, all of my classes suddenly shifted their focus from what we were going to be talking about to COVID-19. And I'm taking a virology class right now, and we're still talking about COVID-19. So it's really just been crazy about how much time we've put into educating ourselves about the disease and how it affects different kinds of people, even people in our program who study cancer immunology or autoimmunity. They've been learning about COVID-19 as much as they can because it impacts people with cancer or different autoimmune diseases differently. So we've all just tried to learn as much as we can and take that into our research.
Very well spoken. Would anyone like to go next?
Sure. So I remember watching as things unfolded before COVID-19 was declared a pandemic, and just sort of feeling like it's a global world, right? Everybody is free to move about the country and free to move about the world. And for me, it became sort of clear early that it was only a matter of time before COVID-19 became a pandemic. And I had a lot of travel planned in early March, and I canceled much of my travel, but I had 2 contractual obligations to travel the weekend of March 13th. And so I remember getting on an airplane and like being one of maybe 3 people on the plane with a mask, but I've traveled with a surgical mask for the 2 years prior to that because I'm a cancer survivor. And so when I became an immunocompromised person, I began to travel with surgical mask on. So people were kind of like laughing at me and, kind of like, giving me the eyes like, oh, really? Like you're falling for this hype. And I remember sitting on the plane next to a gentleman who was in a band, and his band was set to fly to London. And they were on the plane getting ready to take off on their international flight. And all of a sudden they got word that they weren't allowed to travel to wherever they were going. I believe it was London, and that their tour had been canceled. So he was heading back home to Tennessee, and I was heading to do a talk. And I offered him a mask, and I said to him, well, if you're not going to put this mask on, I'm going to put my hood on and turn away from you and go to sleep, because I don't know what's going on here, but I'm on this plane. I have this obligation. I have to go. So I did the first leg of my travel, and my second talk was canceled. So I spent 48 hours camped out in a hotel watching CNN, watching, pandemic documentaries that had come out, and just trying to get familiar with what I would be facing when I returned home. And very shortly after that, so by the time I returned home, the state of emergency had been declared. And shortly after that, patients stopped showing up for outpatient appointments, except for those that were really sick. And then I was asked to come help manage COVID-19 patients in the hospital setting. So of course, being someone who was immunocompromised and on the risk list, I said, of course I'm going to go, because even before I was asked, my family was like, you're not going to go into that hospital and work, are you? And I'm like, well, absolutely. If they need me, I'm not going to stick my head in the sand. Like, if people need my expertise, like, this is what I'm trained for. I'm going to, put on my N95 and whatever other PPE and, go in there and try to help out and handle business. But in the information age and in the age of technology, I actually did a lot of my rounds virtually. I continued to see and manage patients in the outpatient setting, but managed my hospital patients virtually, along with infectious disease fellows in the hospital. And it has been a whirlwind. So now, we went from not really being able to get everybody tested to now have a rapid test in my office, seeing and managing COVID patients every day, now mostly back in the outpatient setting, but face-to-face and virtually. With many, many, many COVID-19 exposures face-to-face late December. So we know that, social distancing practices and personal protective equipment use does work, and I'm grateful for it. And just happy to be able to answer you guys' questions about the experience.
So I think I'm just going to jump in, and I wanted to add that I also did get my vaccination. I did happen to get the Moderna vaccine, by the way. I think they're all pretty much the same, at this point, and I'm really grateful that I was able to get it. My experience, I'll quickly say, with the vaccine itself, with the first shot, I only got a sore arm, to be expected, for a couple of days. Other than that, I was fine. But with the second vaccination, I got pretty sick for about 6 hours or so. I had fever, chills, muscle aches, really bad headache. I mean, you name it, I had it. But literally within 36 hours, like, clockwork, I was completely fine. So I was happy, actually, that I had the reaction, that I knew that my body is actually doing something and making the antibodies. So I felt good about that. But, I shared that with everyone just so, for transparency, for openness, so that I think it's important for us as advocates for, the vaccination and the public getting vaccinated. It's very important to be truthful and honest, so that people don't go into it thinking, oh, well, see, they told us nothing would happen, and then we got all these, symptoms. So I think that part of it is really important. But again, I'm just really happy that I was able to get the vaccination to begin with. So that's number one. As to my experience when this whole pandemic started and all of those things, like all of you guys, I mean, when I first heard about the pandemic overseas, I knew it was inevitable in the world that we live in, with international travel and all of these things, that it would come our way. And I remember when we heard about the first case in New York and then later in New Jersey, I said, that's it, here we go. And I remember it very clearly because I happened to be on call those first 2 weeks, just as luck would have it. And I'd never, ever seen anything like this. I mean, I could tell you the hospital was literally like a war zone. I mean, everybody was gowned up in PPEs. You couldn't differentiate nurses from doctors, from students. We all looked the same. And it was just so hectic. I mean, everyone that was coming in was COVID-19. And, as I'm sure you guys can vouch for it, we didn't really know how to deal with this. So we were learning as we were going along. So every day new information was coming out. We were trying different medications, pretty much anything and everything, to see if, we could help these patients. Unfortunately, we saw a lot of deaths and a lot of people that didn't survive the virus around. And I can say that I'm so, so proud to be in this scientific community, because I don't think we've ever together with such urgency, and develop vaccines with such urgency, of course. Unbelievable. It's incredible. And it makes me really proud to be in this community, even if I'm a small part of it. But I do remember in the beginning, after all, we're human. I was afraid. I said, oh my God, what are we going to do? What if I get it? What if my family gets it? We all had similar thoughts and fears and things like that. And like all of you guys, I pretty much stopped going anywhere, visiting anyone. Everything was virtual. I wasn't visiting my family members or friends or anything. But thanks to technology, we did everything virtually, FaceTime, Zoom, all these other things that are available to us. And we made it through. Yes, even though we saw a surge in, the cases again, but it was nothing even close to comparison to when we saw this thing first last March. And then the number of, ventilations and the number of ICU admissions isn't completely gone down. So even though, we saw after Thanksgiving, these people were mostly getting better. They weren't being admitted for more than 4 or 5 days. And most of them were not requiring high level care, such as ICU care. So that was a really nice thing to see as well. But I think overall, it was just like a really eye-opening experience more than anything, not to take anything for granted. I think that's the number one thing that I've learned throughout this whole experience.
Yeah, all amazing answers. And then the next question is, so during this pandemic, how has your main responsibilities in your career path, whether it be an infectious disease specialist or an immunologist, shifted because of this pandemic?
No matter what I'm seeing a patient for, whether I'm wearing my infectious disease hat or my internist hat, for every single encounter, we always have to consider COVID-19, how we in patient care, it has increased dramatically. Now it's not just that we have to use an electronic health record to document, patients can't sit in the exam room, not the exam room, in the waiting room, with the exception of kind of extraordinary circumstances. And so, we're using, mass text messaging to communicate with our patients. They're texting back and forth with us through computer systems to communicate that they've arrived in the parking lot. We let them know basically like the coast is clear, you can come in now. Just, cleaning like you've never cleaned before. And I think in the infectious disease world, we're pretty aggressive about cleaning up behind ourselves, right, way more than anybody else. And this has really been ramped up. So everything takes more time. You always are considering that whether you're, counseling, reiterating the need to do social distance practices. Prior to the holidays, I had spent a lot of time, really convincing and talking to my patients or educating and counseling them out of having holiday gatherings and, having those I told you so moments with people who are returning with positive cases. So it's never not a part of the conversation now that COVID-19 is in play. Giving patients who don't hit age criteria, but hit, comorbidity criteria to get the vaccine, providing them with letters, trying to direct patients to resources, the amount of time I spend managing phone calls and how the telephones have overwhelmed COVID-19, and sadly trying to help people manage and navigate the inequities associated with being taken care of for COVID-19, as well as the vaccine rollout has been, not for me eye-opening, just another one of those I knew this was going to happen moments. I was very readily able to predict that there would be inequity that is complicating the vaccine rollout on top of all of the vaccine hesitancy that we're dealing with. But the world assumes that everybody has the same access. Patients don't have smartphones, don't have computers or laptops. That sometimes aren't even compensated for or taken into consideration, but you do it because you love what you do, you love being in the service of others, and it's the right thing to do, and it's what needs to be done. So it's definitely kept us on our toes.
Yeah, so with everything being shut down, research labs were shut down. My lab in particular was shut down from March until July. So I was not able to get into the lab at all. So my role shifted a lot from doing actual bench science to doing more reading, I think, than I ever have before, reading everything coming out about COVID. And then I was also fortunate enough to write an invited review to the journal Endocrinology, talking about how obesity impacts COVID-19, and then also how obesity has impacted other infectious diseases in the past, such as influenza, because we know that obese patients do worse with pandemic influenza in 2009, as well as in seasonal influenza. Science communication is also something that's really important to me. So while my lab was shut down, I was doing a ton of science communication, posting a ton on my Instagram and on my Twitter, trying to educate myself and educate others about the severity of the disease and why we need to be socially distancing and wearing masks and sanitizing everything as much as we can. So that was really the biggest shift that I noted, was learning myself and then trying to educate others as much as I could.
Yeah, definitely. Public education about COVID-19, just to dispel the myths, is basically what we're trying to do here, but it's also super important in stopping this pandemic, honestly, because if a large part of a certain population doesn't believe it exists or won't take the correct measures to prevent the pandemic, it's hard to end. So 2 more questions left from me. What do you guys know of the current COVID vaccines available, and what do you think is the best way to get the public vaccinated, whether it be like even distribution or like tiered distribution, etc.?
Well, I can chime in here. Okay, so it's several different levels, I think, to this question. So for most of us on the panel, I think in the healthcare field that were, first lines to get the vaccination, it was seamless, and we didn't know what the rest of the public would go through to even get registered, to get an appointment, to get vaccinated. It's been an unbelievable challenge. I can tell you from personal experience, I wanted my parents to get vaccinated. They're senior citizens, and you would think it would be much easier. it was a nightmare getting an appointment. I mean, the websites would crash the first like minute. The phone calls, the 1-800 numbers, you were on hold for hours, days, and it just became really, really frustrating. And I don't know, I'm not in, the logistics of it to see how best to implement this, but I know this wasn't the best way to implement it. I mean, certainly the people that are of, higher age, greater than 75, those should come first. But like the other doctor was mentioning, a lot of them are not tech savvy. They don't know how to use the internet. They don't know how to use smartphones, many other challenges. So it was really, really a task. So most people have a difficult time getting the vaccination, registration and appointments. I can tell you that. Now with the Johnson & Johnson vaccine coming out, that was approved, I hope this would be an easier, thing to navigate. But as for up until now, it was very difficult to get appointments for the general public and those people that are in phase 1A, 1B, 1C. Some people had to be online even though they had appointments for 5 hours, 6 hours, 7 hours. I just think there should be a better way of doing this. I don't know what that better way is, but I think there should be a better way than, having to go through this method. I mean, the same way that we were able to get it, we had an appointment, we went in and out, 15 minutes. Yes, they observe you to see if you have any side effects, any adverse reactions, but certainly we didn't have to wait 4 to 5 hours on our feet just to get a vaccine that we supposedly had an appointment for. So there's definitely been issues with the whole rollout, and I'm just hoping now, things would get easier and better, and as it becomes, and as we have more supplies, so that the demand that's there would be met easier.
Yeah, I definitely agree with what you're saying as far as vaccine rollout. And I too am hoping that with the Johnson Johnson EUA that because it's one dose, it can be stored at lower temperatures. There will be more access points, perhaps even at people's primary care doctors or subspecialist office, like flu vaccines are available. And hopefully that will stop the bottlenecking at these single points of access for multiple populations coming from multiple communities, because it has been very, very problematic. In terms of how it should be rolled out, maybe I have an unpopular opinion here, but I think that, we really, in terms of making the distribution of the vaccine equitable, have to consider a lot of things that weren't being considered. So it's wonderful that elderly folks got the vaccine first because they're most likely to die. However, the risk of someone who is 75 or 85, not working, retired, comfortably at home on a fixed income, is very different than someone who may be diabetic or obese, who is going out into the world and has, a front-facing job. The person who's working for the MTA, driving the bus or the train, getting us all to work every day, working at the pharmacy, the grocery store, et cetera. And those folks are now becoming eligible for the vaccine, but they're still in the same line as everybody else who needs the vaccine. So an equitable rollout may have considered not just age, but also, what is someone's need to actually leave the house? Do they have to leave the house every day? And is their job high risk, or are they sitting comfortably at home? I think these kinds of decisions get made because people who aren't out in the world taking care of people get to make these kinds of decisions. And so, as you guys are med students and you're considering what your career may look like and how you want to impact lives and how you want to impact your country or the world, these are the kinds of things to consider and the kinds of conversations that need to go on. So as a provider, that's been, very frustrating, talking to people who are desperate to get the vaccine, have higher risk than those who are currently eligible, and not being able to do a doggone thing about it. And then the flip side of that has been, watching and observing people, travel to areas where people are at a greater risk and they don't have access to the vaccines in their own community, but people, crossing counties, crossing even state lines in some cases to go get the vaccine because they can, not recognizing that or not acknowledging that they're taking a dose from somebody who may need it more and just needed a little more time to access that dose. So just lots of things to think about, lots of things that I've been pondering, and just using my voice and my experience to just educate people who are vaccine hesitant to, sign up and get the doses that are available to them in their community. Because when communities don't utilize the resources that they are given, sometimes those same resources are taken away. So when there's a hesitancy to take advantage of certain things or certain programs, when people, sort of feel like it's safe and they're ready, the option is not there for them. So there's short-term and long-term consequences to all of this.
Yeah, great answer. I was just looking up the other day, actually, the racial disparities in vaccine rollouts and how that's been a major factor affecting a lot of Black and Latino neighborhoods, especially in larger cities like Los Angeles and New York. I'd love to talk about that a little bit more. But our last question here today from me, before we get to the participant Q&A section is, what do you think is the best course of action for students, healthcare professionals, or the public to take going forward now that we do have the vaccine available?
I think healthcare professionals can use their voice, use their stories and their experience with fighting COVID or treating COVID-19 infections to encourage other people to get vaccinated. Studies show that people most trust someone who looks like them, someone who relates to them, someone who is a part of their community or works in their community. They want to hear about this from a familiar face. They don't want to watch, the television reports. They don't want to hear about it from public officials or political parties. They want to hear about the vaccine from people they trust. So we can all use our education, our experience, our expertise to not just, get in front of an audience and educate, but also to teach other people to educate. And, then people share those stories from someone that they're familiar with, someone they trust. And then there's a real true trickle down effect of that information, because knowledge is power. So, in this information age, in this social media age, I've definitely taken to social media, as well as speaking on multiple platforms, speaking for community service organizations, speaking for faith-based organizations, doing, social media live conversations with, the cancer community and so many different organizations to get the word out, beyond our 9 to 5 or our 9 to whenever we're finished for the day. I think at this time, we really just can't do too much to get the word out about the vaccine efficacy, the safety or the true side effects of the vaccines, and what the overall impact of getting vaccinated is for us as individuals, for our families and households, and for our communities and the world at large.
Yes. On that note, I completely agree with what you're saying. I think we have an obligation as the medical community to really educate the public. And you're right, a lot of people don't want to listen to the news channels or the authorities, telling them basically what to do. And they want to speak to somebody they trust, somebody they know for many years, and see what their opinion is and what their experience has been with this. So I think we have definitely an obligation, not just to our patients, but to the community at large, to really educate and be open and honest and have a dialogue. Like I was alluding to before, I mean, ourselves, when this thing was first coming out, the vaccine, and I'm sure you might have had the same, hesitation because it came out so quick, you have to wonder, okay, is it safe? What's going to happen? What's the long-term, ramifications of this, but because of the urgency of it, and seeing what we see with COVID and the deaths that we were seeing pretty much every day on a daily basis, you have to believe in science. That's what I tell people. You have to believe in science and believe the scientists and the community at large, that they have our best interest at heart, because this is not something that affected just one country, one region, one land. It's affected the whole world. So in that case, there is no time to sit and wait. Okay, let me see, 1 year passes, how the vaccine worked, what were the side effects? Now do I feel comfortable? There is no time for that. So we have to trust and take a leap, and really look at the data more than anything else, and then make an informed decision. I know a lot of people that are highly educated and they're very hesitant about getting the vaccine. I know doctors that are hesitant about getting the vaccine, and they're some of the smartest people I know. So everyone has their own opinions and beliefs and fears. I think that's what it comes down to. It's fear. But I feel like I can speak for myself that I have an obligation to at least teach and inform and educate. If someone wants to listen, great. If they don't want to listen, I have to talk again, not to, twist their arm, but I just feel like it's so important that they realize what's at stake here. And it's not just affecting them, it's affecting their neighbors, their communities, their families. So we can't just sit back and say, okay, let's see what happens. I don't think we have that, we don't have that privilege at this point. We need to be very vigilant. In addition to social distancing, wearing our mask, washing our hands, and all those other measures that we've been taking that we should continue to do. Definitely vaccination is a game changer. From beginning, I've been saying that to people, and same thing, I speak on social media from time to time. And I said, once the vaccine comes out, that's it. There's no time to sit and say, okay, let me see what's going to happen. This is the best thing that happened to us. We should be grateful that we have it. Now we have a third vaccine. Let's take advantage of, what we have. Many other countries that really do need the vaccine, they still don't have it. They have no access. And, we should definitely realize how, good we have it. And as far as the vaccine rollout, yes, definitely it's been a frustrating and challenging rollout, but I am hopeful that it's going to get better now that this third vaccine is out on EUA. And hopefully, by the time that we get 75% of the population vaccinated, we can come back to some semblance of normalcy, pre-pandemic area, because we do have to, go on and live and, prosper. We can't just sit at home and do virtual Zooms till end of life. I think we can all agree on that. And I'm so grateful to be in a profession that I didn't have to sit at home. As scary as it was to go to a hospital and, put my own life, my family's life at risk, it was still important to be out there and to see what's going on and to help the patients, because they had no advocates. It was the loneliest time for the patients. They had no family members. No one was allowed to come visit them, and to have somebody on their side was a huge, huge, important, thing to do for them. So I just hope that people really listen, they follow the advice that we're giving them. And, I think we have a huge obligation and a chance to really educate the public and be an advocate.
Yeah, some of the things that I've been hearing from young people are, well, my age group isn't more likely to die or need to go to the hospital. So why do I need to wear a mask? Why do I need to care? Why do I need to get the vaccine? And I found that a way to reach a lot of people is to tell different stories. My grandpa had COVID and luckily he was okay. He's a lung cancer survivor. So we were very nervous, but he's a COVID long hauler. He's still experiencing a lot of confusion, a lot of hallucinations, headaches. And so that's one story that does get a lot of people thinking, but also my boyfriend is 23. He's a frontline worker and he got COVID, unfortunately. And he's also a COVID long hauler, even though he's only 23 and fairly healthy. He's still having issues with his heart and his heart rate. And what was really unfortunate is that he got COVID, and then a week later he got the call that he could start, he was eligible for the vaccine. And he was like, if only I'd come just a little bit sooner, I would have been able to get. There's people on both sides of the age spectrum that are both COVID long haulers. And so no matter what your age group is, whether you think, oh, it can't be that bad, you really need to be putting so much emphasis on protecting yourself and protecting your community. If you don't do it for yourself, do it for your family, do it for your friends, for other people out in the world. And I think just sharing different stories is really getting people thinking.
Yeah, Gabrielle, you bring up such an important point, right? So one of the things that frustrated me the most in the beginning of the pandemic was that the news and all the media outlets kept reporting 65 and up, 65 and up. And there was no reason to think or no indication that, young people wouldn't or couldn't be affected by this virus. And we eventually saw that. So what I remind people when I'm having these vaccine conversations is you're not comparing the vaccine and its side effects to nothing at all. You're comparing the vaccine side effects to what would happen if you got a COVID-19 infection. And I think that's a major point that people forget. People think, why am I subjecting myself to this painful arm and these fevers and flu-like symptoms? Why am I going to take a vaccine that's going to make me sick? Because they don't realize that, no, you're not sick, you're having an immune response, and that's exactly what you want. But that immune response and its associated symptoms have a finite duration, right? 24, 36, 48 hours, whatever it is, and it stops just as abruptly as it started. But with COVID-19, you don't know if your infection is going to be asymptomatic, mild, moderate, or severe. You don't know if you're going to be a long hauler or if you're going to survive or if you're going to die. And I really give people just tangible examples of those side effects. And when I think about what are the most quote unquote minor symptoms that some of my long haulers have, like the inability to taste and smell, that's a big deal. To never taste food again. When we talk about people who have shingles, for example, if their shingles pain doesn't resolve in 3 to 4 months, we say, listen, that nerve is damaged. It's going to be painful indefinitely. So my conversation is with someone who has or is at risk for losing their sense of taste or smell. Listen, if you haven't tasted food since March of 2020, you're probably not going to taste it again. If you haven't smelled anything, not smoke, not food, not your baby's poopy pamper, you're probably not going to smell anything indefinitely. And that's the simplest, most minor. When you think about what food is to us, it's our source of pleasure, our comfort, is how we celebrate, is how we mourn. To lose that ability to taste what you're eating and drinking, to smell it and enjoy that, that's a big deal. And that's minutia compared to the people who've had blood clots, heart attacks, stroke, heart arrhythmias, heart failure, people who have COVID brain fog. I've experienced brain fog as a cancer patient from chemo. And that brain fog took me out of work long before becoming immunocompromised and, being susceptible to my patients' infections did. So imagine you're a med student, right? Your job is purely cognitive to an extent. If you're an intellectual and your ability to think straight is compromised, or you end up with chronic fatigue syndrome, chronic muscle pains, joint pains, insomnia, exacerbation of mental health conditions. These are the things that we're trying to prevent. And this is the alternative to getting vaccinated, right? You can get these very well-defined, sort of finite vaccine side effects, or you could get all of these possibilities from a COVID-19 infection. That's the part of the conversation we have to remember to have. And so when we're talking about, educating people and helping people make an informed decision, we want them to make that decision based on the facts as we know them thus far. We want them to make those decisions based on what the real possibilities are, and help them to understand that you're not comparing this vaccine to nothing at all, because you're not getting the vaccine for no good reason. You're getting the vaccine to help prevent a serious symptomatic COVID-19 infection or prevent hospitalization or death from COVID-19. So we have to remember to let patients know, like, it's not the vaccine versus nothing. It's the vaccine versus getting a COVID infection and what that might look like in you.
Those are
Yeah.
great points. I'm just gonna tell you, those are amazing points. And I think that's important to mention all of the real symptomatology and the long haulers and everything that we've seen the patients have, to remind people, look, this is what can happen. Whereas, like 24 to 36 hours of symptoms that basically is supposed to happen to you to develop that immunity, which is what you want. So the choice is yours, but it's a pretty clear choice if you're being objective and not going based on fear and emotions. So definitely, I agree with that. And I think as part of, I guess this panel is more for medical students or people that want to go into the medical field. You guys also have an amazing opportunity here because you're embarking on your journey into this field on a time that I don't think, ever existed before. So as, it's like a double-edged sword. So in one part, it could have been very scary, like I said, beginnings of March, April, and a lot of medical students were not allowed to, even residents, to come into the patient rooms and examine as per protocol. But now you guys, a year almost has passed, you guys have an opportunity to really, spearhead this thing. And once you're going into this field, really go in with the knowledge that, oh, look, we went through when we survived, and, one of the most challenging times of the history, not just, in the medical field, in the world right now. But then you guys can contribute so much by being advocates for your patients as you're starting your clinicals, to be there for them, to teach them, to kind of be advocates for the community that you're going to be participating in and doing your rotations in. So this is an amazing opportunity, I think, actually, to go into the medical field and embarking on your careers in this juncture. So take it as a silver lining, I guess.
Yeah, and with all the questions I have, thank you guys so much for all your insight. That was amazing. And especially what Gabrielle said earlier about young people not thinking they can get it. I'm a little bit younger than Gabrielle, but definitely my age group. And we've all seen the headlines where, local fraternity spikes up cases in certain county. And yeah, well, is that common?
Yeah.
And as we transition over to our participant Q&A section, feel free to raise your hand in chat or ask a question in chat. I mean, raise your hand or ask a question in chat. And first we will have Danielle.
Oh, can you hear me?
Yeah.
Awesome.
Would you like to, you can start your video as well if you would
Okay, perfect. Hi, thank you guys all for speaking today, and thank you, Isabel, for organizing this. So I just have a quick question, especially for you, Dr. Gaffney, who is talking about medical inequities. So I have been reading many instances as a disability studies minor of a lack of resuscitation or ventilation for people with disabilities worldwide. And in England, 60% of COVID deaths were disabled patients, and they're still not on the vaccine priority list. So can you speak to that inequity in particular, and what could be done to rectify that discrimination that's so often seen in the world of medicine against people with disabilities?
Yeah, unfortunately, we have a problem worldwide with how we place value on human lives. And if you live in a disabled body or a differently abled body, a brown body, a Black body, even a woman's body, a female body, we face all sorts of healthcare discrimination. And, it's a problem that, again, has trickled down. So, because unfortunately the world sees everything else that is not male, and sometimes white as less valuable. There is a priority placed on everybody who there's no priority literally placed on everybody else who doesn't, fit that mold or doesn't wear those shoes. And because we've allowed these issues and these inequities to just be passed down and allowed these sorts of behaviors and treatment to be, taught in medicine directly and indirectly, when it comes down to decision making, there is, we're just doing what we've always been doing. And, I'm not saying necessarily us here on this platform, but I mean society at large, right? The way we value lives is different depending on your socioeconomic status and what body you live in and how the world perceives you. So until we really change the world, until we really change and eliminate and extinguish these different inequities that exist, we're not going to be able to do away with these types of, human behaviors. It's unfortunate, but it's also something that needs to be a part of the conversation for why people should get vaccinated. As a Black woman, when I'm talking about why my community needs to get vaccinated, it's one of the things that I say. We cannot afford to live in Black and brown bodies and not be vaccinated and get sick from COVID because we're the people who may be working, front-facing, frontline, these essential employees who aren't not always healthcare professionals, be at risk to get sick and then go into hospital systems or into doctors' offices that do not see us as valuable and will not take care of us the same way they would take care of our white counterparts. So we can't afford to be in a position to die 2 times as much from a virus and also do nothing to explicitly avoid it or prevent it. And, it really boils down to when we're talking about people who are differently abled and people who have, even invisible illnesses where people say, well, you don't look sick. So, I'm not taking you as seriously because you have an autoimmune disease, but you're not, visibly disabled. It's very challenging to get healthcare communities to take us serious. So we have to use our voices, we have to use our platforms. And literally, if we're fighting for equity for one group, we're essentially fighting for equity for another group, but we really have to use our voices. And, not to be political, but that's the time where our political decisions and our choices to vote make the difference, because a lot of times these are in part political decision making, because you're talking about, government funding for hospitals and things like that. So healthcare, in a sense, is sort of politicized as well. So if we don't take that stand as well, we don't have a chance, we don't have a hope to change these kinds of behaviors and change these kinds of decisions. It's truly, truly unfortunate. And I wish I had like a more tangible answer than that, but I don't, but that's what it boils down to.
Yes, absolutely. I totally agree. Thank you so much for answering my question.
Yeah, beautiful answer. And I think that ties into another question we had in chat when she said, can you give more insight into the inequities of vaccine distribution, racial, obesity, income inequalities, and how that may affect overall vaccine distribution? What you said is absolutely right. Gabrielle, would you like to give a little insight about how obesity might be like an issue or a factor for people to overcome when it comes to vaccine distribution?
Yeah, I can talk a little bit about that. So I know when Michigan Medicine was giving out their vaccines, BMI status was in the list of like comorbidities that would help you get placed within tiers. But I don't think that they actually like looked at the comorbidities between tiers. A friend of mine who has an autoimmune disease was offered her vaccine at the same time that I was, and I don't have any underlying comorbidities. And so I think, I don't know how much that they're paying attention to that, at least maybe specifically at Michigan Medicine or throughout. And I also know for obese patients, this isn't really related to vaccine equity, but when obese patients come to the hospital, they're more likely to be put on ventilators, or there are some doctors who don't want to put those patients on ventilators because it's harder to ventilate them. And so that may also be why some patients who are obese have severe morbidity and mortality due to not only COVID-19, but other respiratory illnesses. It's just some doctors may be set in this old mindset and don't really want to work as hard to save these patients, which is extremely unfortunate and not at all what should be done. I don't know if that answered the question, but that is what I do know from the obesity perspective.
Yeah. Yeah. I didn't know that BMI would be a factor when it came to vaccine rollout. It's interesting.
Yeah, an obese BMI was listed as like the highest priority comorbidity because it often presents with type 2 diabetes or hypertension or other cardiovascular issues. And then an overweight BMI was placed as like a lower weighted comorbidity, similar to people with like allergies or asthma.
And then in chat, our next question is, in the simplest terms, how would you explain the mRNA vaccine, how the mRNA vaccine works to someone who believes that it will change your DNA? I live in an area that is highly skeptical of the vaccine, and I do not know how to get the point across that the vaccine cannot change your DNA. Do you know of any resources that explain how the vaccine works in simpler terms? I know before.
The CDC itself actually explains it in pretty simple terms if they want to just check out that. I mean, it's easy to understand it, but it basically, the mRNA is, as the name suggests, messenger RNA. So that tells your body that, okay, this is the code and this is what you need to do to make this particular protein, in this case being the spike protein. So then the body makes that spike protein, and then the body realizes, oh, this is not something that belongs inside my body. It's a foreign element. So then that triggers the body to initiate making antibodies, which is basically, think of them as the policemen in your body. And also it triggers making memory cells inside the body, so that when you actually do encounter or are exposed to COVID-19, your body is already prepared with those antibodies. And then you also have the memory cells that remember that protein, that foreign protein, and they trigger also another antibody response. So that is the whole reason, you get the vaccine, so that you don't get sick. And the reason it doesn't affect your DNA is because that mRNA is not inside your nucleus. It's in the cytoplasm, and it actually gets degraded and gets out of your body after it's done doing what it's supposed to do, after the body reads it and makes that protein. The DNA is inside the nucleus of our body, so there's no way that your DNA is getting affected by the mRNA vaccine. I don't know, I think this was pretty easy explanation, but that's it in a nutshell. But I've heard all that stuff as well, so that's why as soon as you mentioned that question, I jumped on it, because it is frustrating to keep explaining it over and over to people, but yet we have to, because a lot of people don't know. We can't assume that everybody knows how vaccinations work, especially this being a new vaccine. So everybody that was already hesitant being even more hesitant, that why should we trust this new technology? But that's pretty much the answer in a nutshell.
Yeah, and then we have a quick thing. I think one of the arguments I actually came up with talking to actually college students, fellow college students, is that if the disease itself cannot change your DNA, the vaccine cannot change your DNA either. So easy metaphor. And then Danielle has raised her hand again. Danielle?
Hi, sorry, I have another question if that's all right. Can anyone speak to the prevalence of multi-system inflammatory syndrome in children that's associated with COVID-19, kind of why it's affecting that population so differently and so drastically as opposed to someone who kind of ages out of that grouping?
So the multi-inflammatory syndrome that we've seen in pediatric patients, I can't remember the exact prevalence or percentage rate of infected children, but it's clinically identical to Kawasaki syndrome. And we always have suspected that Kawasaki syndrome was a post-viral syndrome, but because we've not been able to identify a virus previously, that was just our speculation. There probably is some sort of maybe genetic predisposing factor to it that has not been clearly delineated at this point. But it makes sense the way in which it presents, several weeks after a child has been exposed to COVID-19, they're no longer shedding the virus, but it likely has something to do with the immaturity of an immune system or just an overactivation of an immune system, which is, a hallmark of COVID-19 in severe cases, is that so many inflammatory pathways are activated. The immune system is so overstimulated by this virus that the body is essentially harming itself in a small proportion of patients. And that's true for our pediatric population as well. So it's imperative, it's important that we keep our children safe until we have vaccine data and we are determined if it's safe to vaccinate them or not, because it's just like COVID-19 infection in the adult population. We don't know who is going to have mild illness, who's going to have severe illness and need hospitalization, and who is going to die. We don't know which of our children is going to face one of those complications or unfortunately experience this multi-system inflammatory syndrome. But the consequences can be devastating and lifelong. So people need to be on the lookout for that classic syndrome of fevers, headache, bellyache, and what we call strawberry tongue, fissured lips, and the peeling rash of the fingers and toes in children. They need to get evaluated immediately. They need to have their coronary arteries evaluated because they can develop aneurysms, and they need very specific treatment, which is IVIG and aspirin therapy, which we, think aspirin we don't even give to children for so many reasons, including how it interacts with viral illnesses that are common in the pediatric population. So there's no specific prevalence, but I think it's an important point to remind people when they, say that children are not at high risk for COVID-19. That's a major consequence, and there's no way to predict which children will experience it and which will not.
Thank you so much.
I just want to mention one thing. Isabel, unfortunately, I do have to go, as you know, because of time constraints, but I just wanted to leave you all with just one tidbit here. No one is immune to this virus. If that's one thing I would like to leave this with. Everyone should take the necessary precautions. Everyone should take the vaccination once it's available to you, whether it's based on your age or comorbidities. Whenever it's available to you, get the vaccination. Especially young people, you're not invincible. You definitely have to continue to social distance, wear your mask. You can get just as sick as, a 90-year-old. There's really no difference. Certainly, we've seen our share of very, very ill patients at the hospital that were very young. So this can affect anyone. None of us are, safe from this virus. So please, I urge you all to take the vaccination once it's available to you. And that's our best, defense against beating this virus, along with all the public health measures, that we've been doing. I do have to go, but I really did enjoy, being here and being part of this panel. I hope that I was helpful and I was able to shed some light, through my experience. Thank you.
Thank you. Good night.
Thank you so much for
Good
coming.
night. Good night. Bye-bye.
Good night.
Thank you. Bye.
Bye. All right. Does anyone else have any last questions? But I think we're actually going to start to wrap up now. If anyone else has any last questions, Danielle, if you would like to finish your question or ask for any other specifics.
No, that's okay. I just wanted to thank you for answering my question. That was very helpful.
If anyone else has any last questions, please leave them in chat now or raise your hand. All right, then I think we can proceed on to closing remarks where we just wrap up any last words, and then you can leave your socials in chat and any links, resources, yeah.
I'm dropping my Twitter and Instagram in the chat. I do a lot of science communication on both of those.
I'm on Facebook, Instagram, and Twitter at Dr. Alexea. So it's just DRALEXEA. I'm on social media, always talking about so many different things. Of course, talking about COVID-19, talking about the vaccine. I'm a breast cancer survivor, so my platform is also dedicated to educating about breast cancer in general, but especially breast cancer in Black women and breast cancer genetics. I have a gene mutation that predisposes me to breast cancer. So you can find me talking about so many different things. It's all intertwined, and it all boils down to, kind of our immune system, our immune function, and our immune health, sort of the things that I used to help boost my immune system when I was treated for breast cancer are the same modalities that we are using to, help strengthen our immune system, I guess, if you could say that. But that being said, all of the sleep, hydration, exercise, healthy eating, supplementation in the world will not prevent a COVID-19 infection altogether. And just like cancer, perfectly healthy people get COVID-19 and get serious symptoms, complications, and are at risk for death from the infection as well. So, you do all the things that you can to take care of yourself. You continue to socially distance, you continue to wear your mask, and when you have the opportunity, make sure you're making an informed decision about vaccinating yourself.
Thank you so much for coming. And Gabrielle, any last words?
Thank you so much for having me. This was so much fun. I would encourage all of you guys to, if you haven't had a research experience already, to think about trying research. Before I started my PhD, I was actually pre-vet. And after I started research, I absolutely fell in love with it. One of my PIs is a pediatric endocrinologist and also has her own research lab. So if research is something that interests you, but you're also interested in medicine, you can definitely do both, and it's great. And if anyone has any questions about research, I'd love to answer them.
All right. Well, I would like to thank everyone for coming, especially the panelists. If you guys did not, last word for the participants. If you would like an email directly about the virtual shadowing hour certification, please register with the link in our bio or bit.ly/GenMedDTR. We will be, uploading this recorded session onto YouTube for people who could not make it. And yeah, I would like to thank everyone for coming again. All right, bye. Have a great night, everyone.
Thanks for organizing this, Isabel. Have a good night.
You too. Bye.